Many adults with undiagnosed ADHD experience difficulties in relationships and at work, struggle to manage their emotions, and feel they are underachieving. A diagnosis helps people understand why they find certain things difficult and opens the door to different treatments that can reduce the daily impact of symptoms. We know it takes a lot of energy to contemplate seeking an assessment, and just how important it is that the outcome is correct, reliable, and reputable. The assessment starts with us sending you a pack of questionnaires that we ask you to complete and return prior to your first appointment. Some questions need to be answered by an informant, and your informant is ideally a parent, but it can be a partner, family member, or friend, someone who has known you for a long time. Some adults, due to their circumstances, find it difficult to identify an informant who can comment on what they were like when they were younger. In the absence of an informant, sharing documents such as school reports or appraisals from work can help the team understand the perspective of others who know you. You will then meet with a clinician at one of our clinics, where the QB test will be administered. The test, which measures your activity levels, ability to concentrate, and impulse control, is performed on a computer and takes 20 minutes. The QB test is different to the QB check, with the QB test benefiting from a clinician administering the test and taking observations of you during testing. A video call will also take place with a psychologist or psychiatrist, where you'll be interviewed about your concerns, early development, education and work, and medical history. Detailed questions will be asked about ADHD symptoms. This appointment typically lasts around 2 hours, and your informant should be available to participate. Your psychologist or psychiatrist will then consider all the information gathered and make a diagnostic decision about ADHD. They will feed this back to you during a follow-up video call that lasts up to 1 hour and confirm the outcome in writing via a comprehensive report. A short letter can be produced to share with your employer. Please note that we are not able to prescribe medication for the treatment of ADHD. This is not the only treatment option available, but if it is something you would like to consider, a consultation with a doctor will be required. Any prescribing is entirely at their discretion.